Thank you, Doctor, for the introductions. Yeah, can I have this? Thank you. So, thanks for invitations, and let's start. Today's words I'm going to share during this session is about how the TCMs, or traditional and complementary medicines, to be more precise, is Chinese medicines being incorporated into the cancer care throughout the world. And here what you can see is being incorporated as integrative oncology, whereby the care for the cancer out there is no longer only focused on our conventional medicine, but it's also involved other disciplines, not only the primary medical treatment, but lifestyle behavioral approaches, which involve our psychosocial supports, which mentioned by Dr. Nadia earlier on, and another psychologist mentioned in this morning session as well. But at the same time, some things that we as a conventional medical doctors or oncologists always overlook is the complementary and supportive therapy part. And out of my surprises now, it's actually been highlighted by Dr. Nadia in your findings, whereby the patients actually very interested to discuss more about the traditionals and the complementary remedies with their oncologists. So, sharing with you what we have been incorporated the NCCM into the government hospitals for the past, we started this in 2008, and it's nothing new outside the Malaysia. It's been practiced and selected into different reputable cancer centers throughout around the world, whereby, for example, Christie that incorporated aromatherapy, acupuncture, and so on and so forth. Even MD Anderson that have integrated oncology physician consultation, acupuncture, meditation, music therapy. All this has been actively incorporated in part and parcels of the cancer care. So now, even Mayors, Memorial Sloan Kettering Cancer Center, there is, and we even have people being trained under these institutions and trying to adopt and adapt what are the effective or efficient model that we can incorporate into the cancer care for the patients. So now we are talking about more on evidence-based, because when we mention about TCM, you will think there's no scientific proof. But in reality, there is, and more mounting evidence actually points towards there are proof or evidence to support the usage of complementary interventions. So, sharing with you some of the key concepts of how the TCM concept in the management of cancer. You'll be surprised they are not only talking on treating the cancer alone, as compared to the classical teachings in our medical oncology or clinical oncology. Now, definitely, we have developed more to psychosocial support and other allied health to come into the pictures. But for TCM, it has been incorporated even before we talk about this, because we see patients as a whole instead of just looking into the cancer alone. So you will see here, there will be a part whereby anxiety, so they will look into the patient's psychological or emotional states before they actually treat the patients on the oncology part. So these are some of the key concepts, which is, I would call it advanced in the sense that there are philosophies and the concept being incorporated earlier on is there, and earlier than what we actively incorporated into our cancer management now. For example, immunotherapy. So immunotherapy is something trending in our cancer management. But do you aware? You may not aware that TCM has been putting this even before talking about we maybe incorporated immunotherapy into our cancer management. So they put in the immunity and there's an anti-tumor as equally important in the cancer management. At the same time, they have other methods trying to reduce the oxidative stress and then improve the normal vessels. If you're aware of the cancer management, we have avastin, we have EGFRs inhibitors, and all these things actually, and then there are some things for the extracellular matrix, trying to re-regulate by using different TCMs methods, interventions, for example, herbal medicines, and reduce the flame and waste. This is more towards the TCM concept. But the previous four that I mentioned here is actually somehow already matched to our current trending cancer management. Okay, so you can see that here we are talking about how actually we look at the TCM in their role from a scientific point on in the cancer management. So TCMs not only focus on the cancer management alone, but we also focus about prevention. Okay, so here you will see that even the precancerous lesion, they have already something offered for the patient. So in the Shanghai hospitals or the Nanjing hospital that I worked before, if you're aware, the screening methods or tools that has been adopted by the China government nowadays is actually far more advanced compared to what we have here. Okay, so they're even doing a CT scan for the lung screening, but this is mostly focused on those highly urbanized cities, for example, Beijing, Shanghai, Guangzhou. So they are able to pick up a lot of early precancerous stage type of cancer. For example, lungs, whereby they have nodules, whereby you are not sure whether this is really a cancer or not, less than 0.5 cm, but there is a nodule, PET scan is not active. Or you have a chronic atrophic gastritis, because in Shanghai, people tend to eat a lot of sashimi, things like that, like Japanese do. So they have been actively incorporating the gastric screening as part and parcel of their screening program. So they're able to pick up a lot of precancerous lesion. And with that, we have limited intervention for our modern medicine. So what they can do, actually they go to TCM's center and look for a treatment for them. And there are more and more papers coming out on how the TCM is actually able to treat the precancerous lesion. So this is something which is actually a lot of people doesn't aware, they do not aware of such thing actually happening in the TCM. Early stage, and yes, when we talk about early stage, we encourage for a curative treatment. I think since we are attending a National Cancer Congress today, you should be aware that most of the early stages curative approach is our main objective. And it can be surgicals, and it can be using radiotherapy for NPC. So these are some of the key interventions we have in hand that's able to and allow us to have a curative management for our cancer patient. But the approach for the TCM will be different. They are not talking about, here they are more towards supportive role, prevent and treat post-op complications. So for those who is really properly trained TCM practitioners in oncology, they will refer the patient for surgical approach. They will advise their patient for a breast cancer early stage, go for the surgery. You do lumpectomy or mastectomy, and if you have an NPC, you go for radiotherapy, concurrent chemoradiotherapy. It's not asking the patients away, but stick only with TCM. So the idea is different from what's in your mind that there. For example, this morning, Dr. Anil, he mentioned that a lot of TCM's medication, they're considered steroid. Okay, if you could recall, I'm sitting in front of him, he's talking about, TCMs are considered steroid. So, is that true? This is a stereotype perceptions among the public, including our healthcare professionals on TCM, because of, I would call it, historical problems. Okay, but those modern day trained TCM practitioners, they are well versed not only in their TCM, but also in conventional medical treatment. So, for example here, they are fully aware of the curative approach our Western medicine can offer. So there were no hesitations to refer patients to conventional medicine and get the surgery done. And for the medium advanced stage, here we are talking about what? We are talking about reduced adverse reactions, because we know about our role in the cancer management plan. We are fully aware of the limitations, what TCM can do. Okay, so here, when the patient is receiving chemo, radio, immunotargeted, if they suffer any form of side effects, like this morning I've discussed with another medical oncologist from Brunei, he's actually happy to know that TCM can offer acupuncture for the patients with the chemo-induced peripheral neuropathy, whereby they end up with a lot of numbness in their hands and feet, whereby our conventional medical side, we have very, very limited interventions available for them. Okay. And lastly, of course, the last part is definitely more towards palliative care, whereby we want to improve the quality of life, extend the overall survival. So sharing with you some of the papers published by my team in ICANN last time. I was in ICANN for 6 years and very actively involved in different types of research, not only restricted to survivaliships, not only in survival, but also in elevating the side effects from the conventional medical treatments. And this one is the one that I did it in Shanghai last time. And here we are focusing on the pancreatic cancer, looking into the overall survival. What we found out in this study of 272 patients with pancreatic cancer, here you can see that the overall survival is actually 12.7 in months in the TCM groups compared to those 9.9 months in the non-TCM groups. Meaning those who receive the TCM, the herbal medicine, actually they can live longer in advanced pancreatic cancer. That's one thing. Another thing, you will be surprised for those who is able to achieve a surgical resection on the pancreatic cancer. Here is the result. You can see here, they can live almost double compared to those not receiving TCM medication. Okay, after resection, you will do whatever chemotherapies, radiotherapy as what we offer for our conventional medical care. But at the same time, just add on the TCM herbal medicines is able to almost double the median overall survival. You can see here, and is statistically significant. And putting the pancreatic cancer aside, what we have done in ICANN, National Cancer Institute, is we want to test, because in ICANN our team power or the capacities or resources is very limited. We can only focus more on the side effects. We do not have enough manpower. For information, I only have seven person in my team. So I have to rely on these 7 persons to do a study and get it published. So we can only look into the radiation-induced xerostomia as a treatment-related adverse event. Meaning, for the NPC patient, nasopharyngeal carcinoma patient, after they have completed their chemo plus the radiotherapy, most of them, more than 90% of them, they suffer the xerostomia, which means dry mouth and the taste alteration. So what we are offering to them is actually a herbal treatment, and want to see whether this helps. And the result is very impressive. It's a positive result, and we have get it published. And this is another one. We want to do a mapping on the interaction, because this is something which is I always face the challenges from the medical oncology, whereby they ask me if I allow my patients to take the herbal medicines at the same time when the patient receiving chemotherapy, is there any interaction? So this is another study we have been doing, a scoping review protocol. And last year, we even sent one of our team members who actually won a merit award from our the National Cancer Congress 2024, whereby we used a non-invasive maneuver for the patients after breast cancer end up with lymphedema. And for information, lymphedema means the swelling of the upper limb. They suffer this, and again, we have very limited interventions from our conventional medical side to offer for this group of patients. Why? We can only offer them physiotherapy, whereby most of them may benefit a little bit, but not most of the time. And then especially the most malignant one. So we have a maneuver and we have interventions from the TCM side able to solve the problem for the patient. So we get it published last year. And now, even the key persons in charge of this research, we are doing another research on to see how the acupuncture is able to improve the quality of life for those cancer survivors. So it's working with Sunway Healthcare Groups, Sunway Medical Center, and Sunway University, and still actively recruiting, but I was informed it's overwhelming response. We only have seats for control group, right? Okay, we don't only expect to accept about 100 patients. Intervention group, we have already achieved far exceed that, 60 or 70 intervention group. Okay, so sharing with you another case, because we are only talking about published. These are some of the real cases happening in our center. This is Mr. C. It's a stage 4 hepatocellular carcinoma. Actually, the patient first discovered with HCC, liver cancer, and get it resected in 2019. But it relapsed. So they choose to opt for radio frequency ablation. For those who have a background understanding on what HCC is a highly fatal type of cancer. And then those stage 4 cancer, liver cancer, actually the overall survival rate is very limited. We only expect maybe about 1 to 2 years, the most, okay, in this case. So the patient first presented to our TCM clinics in January 2020, and abdominal discomfort, poor appetite, because after the RFK, the patients have some deranged SDLT and some high alpha-fetoproteins. These are the figures. You can see the player is 45 because of the splenomegaly, and there's total bilirubin 90.5, but the kidney is quite okay. He declines any form of systemic therapy because at the moment of time we already start to aware of some of the available interventions, for example, targeted or immunotherapy. But he refused. So, okay, I have no choice, because sometimes we TCM practitioners also be very cautious in treating this type of cancer patient because we worry we get sued as well. Okay. Yes, this is very valid questions. Okay, you go to accept someone with stage 4, and then after 2 months taking your medication, patient pass away. Then they will get all the blame towards you. So we are very cautious, and then we have a very open consent, and then discuss with the patient and get it done. So the patient received the herbal treatment from 2020 to 2025. Till date, he still survived, no relapse. So I'm just sharing with you, this is some of our tongue photo. As part of others of the TCM diagnosis, we do keep the patient's tongue photo because this will provide some valuables insights on the patient's body constitutions and guide us on our prescriptions. And these are the prescription. For those who always claim that after taking the herbal treatment, the patient ends up with liver failure, kidney failure, and you can see that the patient is actually having some elevated SDLT, and then AFP actually improved after 3 months post-herbal. Okay, so put that in mind. Not all the time the TCM will cause liver or the kidney failure. In reality, I've only met 2 cases for past 20 plus years being a medical doctor. Okay, and then this is the latest. The EGFR is still working. Yes, the kidney is still functioning after 5 years taking my medication. Thank God. Not end up with a nephrologist for end-stage renal failure. And then they have done a PET scan, cirrhotic liver with splenomegaly, no signs of recurrence. So these are some of the key highlights I would like to share with you. For this patient, there's no targeted or immunotherapy use, stable AFP, and no relapse for over 5 years. But bear in mind, from time to time, you may hear that someone receiving TCM interventions and doctors actually offering palliative treatments and still survive after 5 years or 10 years. One case doesn't represent all general cases. This is something you always need to bear in mind. Okay, and this one, patient's renal and renal function is preserved. Prognosis for the relapse is actually typically poor, less than 2 years survival, and potential supportive role of TCM in long-term survivorship. And we like to write this into a case report as well, and then further research on integrative strategy is warranted. So with that, I would like to conclude my presentations and pass it back to our chair.